Hey guys, Dr. Hunt again at Hunt Physical Therapy. Welcome back. Today I'm going to show you how to bulletproof your shoulders. What I mean by that is to get all the tissue, all the muscle in that area strong so that the shoulder joint is supported and moving mechanically well. As a bonus, I'm going to show you a joint technique to realign the long head of the biceps tendon. Sometimes when people have a snapping and painful sensation, especially with bench pressing, that tendon's kind of out of the groove of the upper arm bone. A lot of times that's due to overuse and perhaps weakness in the muscles that externally rotate the arm. It's a big source of bicep pain, so I'm going to show you a technique to help with that, and again some exercises to really get your shoulder joint healthy and functional. Okay guys, first up, the joint technique. Okay guys, here's that joint technique I talked about to kind of realign that bicep tendon that may be out of place in the groove in the upper arm bone called the humerus. All you need is a door frame, so just position yourself kind of in the door frame like that. You don't want to be outside too much, okay? And like you're putting your hands on your hips, do that, but have your elbow against the door frame, okay? And then as hard as you can for a few moments, just push back into the door with your elbow like that. And a lot of times you'll feel a shift or maybe a clunk or pop in the front part of your shoulder. And we think that's that bicep tendon going back in the bicipital groove, or even could be the arm bone, the humerus realigning in the shoulder joint a little bit. We think sometimes tightness in the back of the shoulder capsule can push the head of the arm bone anteriorly. So it might be realigning that a little bit. So again, hands on your hips, elbow against the door frame, and then like you're pushing back into the door frame, hard as you can for a few moments. Try that at home, okay? Now we're going to show you some exercises. Okay guys, now I'm going to show you my favorite exercises to really bulletproof those shoulders. These exercises are useful to not just treat, but to prevent the major sources of shoulder pain, which are tendonitis, bursitis, and those arthritic changes that happen to all of us, especially after midlife. I tell all my patients, if you're 40 plus, you need to be doing some shoulder exercises, especially rotator cuff exercises a few times a week, just to protect your shoulders. So let's start out with simple external rotation with this small band here. Just placed around your wrist, elbows against your body. With all these exercises, think 3 sets of 15 reps a few times a week. But again, just rotate from out to in, pause for just a half second or so at the end of the contraction. The next one you can do with this, arms straight, palms down, and just bring your arms straight out. Here, I'll turn to the side so you can really see the muscle contraction. This is a nice exercise for the posterior deltoid, the back of the shoulder. Again, pause for a little half second at the end there, okay? Now, some dumbbell exercises. The first one's called flexion. I've got these 5-pound dumbbells. Just bring them straight up to shoulder height like that. Again, pause at the end of the contraction for just half a second. In the gym, I see a lot of people just kind of slinging weight around like that, and not only is that unsafe, but it's not as efficient. When you go in a smooth contraction like that, you actually recruit more muscle fibers. So 3 sets of 15 with shoulder flexion, and then I'm going to turn sideways so you can see shoulder abduction. On this one, stay below shoulder height. So that's probably about 60 degrees there. Some people, I want you to really listen to your body. If it starts hurting beyond that, stay low on this one. So just stay below shoulder height and keep this one in a comfortable range. A lot of PTs are afraid to give this exercise because if you go up too high, you can pinch the rotator cuff if it's inflamed. But I find if you stay kind of halfway range, you're pretty safe. And this is a very useful exercise to rehab the shoulders. So keep it low and pain-free, okay? I'm going to get some slightly heavier weights and show you shoulder shrugs. So this works that upper trap muscle, very important for rotator cuff health. So just shrug up just like that, engaging that upper trap. On this one, the elbows, it's useful that they stay slightly bent. I'll turn sideways so you can get a different angle. Again, 3 sets of 15 reps. Okay, now we're going to use some bands. We're going to do 2 exercises called diagonals. So essentially you're going to be working at an angle our diagonal vectors. So we're going to start with the first one where you're going from up to down. So just bring the rubber band and your arm down at an angle, like you're doing a slashing motion. 3 sets of 15. And then lower the rubber band in the door. And you're going to go in that diagonal angle going up. Now, the main thing with this one is keep your thumb in an upward direction. So you wouldn't want to do this with your thumb down because that could cause pinching of the rotator cuff. So grab where your thumb's going up towards the ceiling and just go up at an angle like that. Okay, 3 sets of 15, 2 or 3 times a week. All right. Let's get this heavier rubber band. And last but not least, I'm going to show you 2 more. On this one, put the rubber band in the door around chest level, and we're going to do some standing rows. So with the standing row, it's really important that you engage your shoulders, pinch your shoulder blades together so that your chest comes out like this when you bring it back. It's not just an arm motion, it's a back motion. And you know you're doing it right if your shoulder blades pinch together and your chest comes out like that. Again, just squeeze for about half a second at the end of the contraction. And then the last one, arms stay straight on this one, but same principle. Pinch your shoulder blades together, chest comes out like that. This works the back of the shoulders as well as the upper back. So these exercises are designed to fix poor posture. A lot of people kind of walk around like this because the muscles in the back are weak and tight. And so doing things like this, you can see how that promotes good alignment. All right, guys, so that's it. Hope you enjoyed. Please feel free to leave comments below. If you like, subscribe. We appreciate your support. We'll see you next time. Thank you.